improving sucking. Okay, let's go into what sucking is. Most people think that sucking is a reflex. It really isn't. What it is, and I've published and presented on this, it's out there, and I can send it to you if you need. What it really is when a baby presents in vaginal full-term delivery, part of the process is the head gets pulled out, very much like a champagne cork, right? You can see this. There's birthing videos. I posted them and discussed them about an live MRI of babies, but their heads mushroom out. Again, very much like a champagne cork. And this force of articulation of the skeletal bones in the cranial region, right, pull, and they create a palate strike. So the tongue gets pulled up and goes with that. Right now the baby is coming completely out of the mother, and that, just like a champagne cork, you know, when they do it and the bubbles fly all over it, well, your baby has foam in the lungs, and that opens up the foam in the lungs, it matches gravity, they're first expended, and that's when you get that wow of a baby, right? You are meant to have a good first breath cry when you're born, right? Because you're opposing gravity for the first time in intake and elimination, which is your breath. But it's intake and elimination, which is also related to the tongue and the sucking. The breath comes first. The breath will always come first because you have to have a breath-swallow ratio. Now, when a baby breastfeeds, and if anybody listens to this, if you can just, even for a couple of days, breastfeed, because of what it does to their movements, a baby is coming to the food with the breast. And also the tongue is more presented to the front of the mouth. And the big thing is it's bilateral. So you're learning this way, but you're also getting it on both sides. When you're nursing, I'm right-handed. Most cases, I'm only going to be nursing on my unilaterally. One side, and they're only getting that visual set up versus this side and this side and this side and so forth, because and they're learning how to come over their system. They're learning much more of an absolute horizon, and they're learning how to suck, which is also from the side. One of the things that you're not really meant to do is to suck from back here. I've seen modalities teach this. I don't agree. And they do this kind of thing. This comes later. But when you have that, especially when you don't have the right bottle, right? Here are two different bottles. That what the baby's doing, the suck is deeper in the mouth, first of all. And that suck happens in a way that the milk is falling into their mouths. They're on their backs, right? And they're preventing the fall. You know, you might have a lot of more of that first gag. They should gag. There's meant to have it, just like when you're breastfeeding and the milk lets down and they get that. That's fine. But you get more of a gag response. But also, this isn't moving. This is your spinal column. When I'm nursing, right, I'm twisting and I'm nursing and all of this. I'm going to be less constipated because I'm getting a core movement workout. When I'm here, you know, especially on my back in an angle, you know, and oh, look how hard the suck is. Well, look how hard the milk fall is. But this isn't moving. And I'm here, and I'm not getting the development movement. I'm not getting a pre-call movement. I'm not learning how to ride a bicycle. This, I'm learning how to ride a bicycle. This, I'm not, right? Again, you're thinking your baby's a day old. These movements go someplace. They go out into the great yonder, but they're part of, and that's where people think that I'm psychic, because I see a child that they can't ride a bike. I'll let him bottle, you know, they didn't nurse. Well, how did you know that? Because they're riding a bike like this and they're trying to do this versus doing this and this for their bicycle riding. So, and it all can come, yes, it can come down to nursing. And I'm not saying that it's bad that your child didn't nurse. I'm trying to show you there were movements that meant to happen, and if they didn't happen, we're going to have to create them through touch, through this, and that's why I have the suck and swallow course, the pre-feeding course. Another problem is 3 a.m. Do you want to go up and change this bottle or this bottle, or have 3 of these versus 1 of these? this is too much weight on a new baby. And so you're getting a lot of that, and people are worried if there's tongue tie issues and so forth. A lot of it is just the weight of this bottle. Again, the smaller the bottle, so they could reach. Wow, a small bottle that you can be here reaching this, you know what I mean, could create a torticollis, let's say, because you went too big. But people don't think of these things, right? It's like having oversized gloves when you need, like, you're not going to play golf and ski mittens. That makes sense. But again, people make this mistake, by the way, too. If your kids at little leagues and so forth, don't have them hit a bat that they'd be using in high school. They have to size up. They have to, just like a baby, learn weight transfer, transitioning skills, and rotational movements. But all the little kids want to play in the big boy stuff or the hand-me-downs, and their equipment doesn't fit them. Again, if these analogies make sense to you, don't do it to your babies, right? And so what happens with all of this, and again, with this, I'm really starting to learn rolling over. I've got a pubic bone strike starting to form out, and I'm nursing. With this, I'm missing a lot of these skills. And so now what starts to happen is I want to come over my system to get to it. Now I'm starting to get a crunch, right? And the baby, I've held the bottle on my own, and I'm trying to do this. And let me tell you guys, I don't have to go to the gym if I even just practice holding this and those kind of crunches. It's just not natural movements that a baby should be making, right? And we want them to eat and finish their bottles, so we might be putting them now in a car seat. I've seen people with a thing here, they put a blanket on, and like this, and this baby is just hands down, and they're literally just eating like that's it. And the parent is literally kicking the car seat, so they're rocking and they're drinking. What is that? It's there's development, guys, and there's preventing development. That's a good one. So when you're going into these skills, but what a big one is now I'm going from this, I'm in tummy time, I'm rolling over, I'm going to move my bottles, and now I'm going into around 4.5 months, right? I should be doing a thing which people see as planking. It's not. It's a pubic bone strike. You'll see the airplane kind of going on, but a child will start to do this and get up and go down, right? That's a pubic bone strike. That pubic bone strike allows the tongue to come out. Raspberries, really important development. And the tongue comes out, and then you can start, that's why about 4.5 months, you can start with rice cereal if your baby has had the pubic bone strike. And this is where people go, well, my baby's 4.5 months old, they're not eating. Do they have a pubic bone strike? I get it. What? So you'll see those kind of movements that are really important. But again, if your child is even older, and they're in the sucking thing, especially, let's say, older, independent sitting, 5.5 months, you should start to see, again, we go to our food. This start to happen. There's a big difference in the high chair, if I can hold my bottle, to do this, and a pubic bone strike versus this. You know, you're seeing sucking and swallowing, but the quality there, this is not going to get you too far, especially too, you guys are challenging me. If I'm here, again, can you do it when you're sitting there in a full-on crunch and you're trying to suck? There's no pubic bone strike when you're in a car seat doing your feeding skills. The spinal swing is out, it collapses the back, it doesn't have the pelvis. When I'm here, right, in a car seat, right, and I'm trying to eat versus being able to have that kind of thing. This is a pubic bone strike, even though I'm here and doing something like that. But if I'm in a 5-point harness, that's not happening. So this is where people get confused and they think that their skills have softened or changed. One of the big reasons is your child's starting to get larger. They get a wider palate, right? And so you're asking them to do suck skills where they used to have a smaller mouth to go around this, right? And now they're going into larger skills. So these are the ups and downs that you have of swallowing and eating, but they go and coordinate with your child's development. So please, when you're looking at different aspects of eating, you have to look at different aspects of where they are in development. This is the same for vision. This is the same for the push-pull milestones. They're all charted out and they need to be looked at, because like you can't have lack of vision and development. It just doesn't happen. You need to keep them the same. It's the same thing with the eating skills. You start having eating skill issues, you're going to have issues. You've already had issues with development, right? And it depends on which cart you're watching, but they are coordinated and they have to be looked at. So to constantly be looking at to improve that swallow because you think it's a reflex and you're not looking at all of this, you're not going to get the benefits that your child needs right now from you as their development coach, because that's what you are. You know, you've taken on that hat now. You've got to work with your child's development, but that's what you're looking at. Thanks.